Let's talk about gestational surrogacy. What is gestational surrogacy? What's an indication or why people will opt for gestational surrogacy? Gestational surrogacy, also known as an IVF surrogacy or host surrogacy, is the process whereby a person carries a pregnancy for someone else, the intended parents. Therefore, the two couples are in are not able to carry their pregnancy or don't have a uterus. Therefore, somebody decide or somebody offer herself to carry that pregnancy for the two couples to term. That is called surrogacy. During the process, the, the gestational surrogate becomes pregnant through an IVF process. In other words, an IVF must be done so that the gestational surrogacy can be successful. Now, the IVF process is done when an egg and a sperm is fertilized in the lab, and both seem to be progressing to blastocyst stage. And at that stage, the gestational surrogate mother womb is prepared so that it's ready to carry that particular embryos or blastocysts. Therefore, in this case, we can either use your eggs as a person who require somebody to carry your baby, or you can use donor eggs. As well, you can use either your sperm as a couple, or you can use donor sperm for the process to be successful. Now, gestational surrogacy do not it's a whereby certain condition which may be found in either sex, either the mother or the father, husband or the wife, prevent the couple to carry their baby to term. Then what are the indication of this condition? What are the indication? Why should people ask to have what we call gestational surrogacy? The one commonest fact, it may be what we call today LGBT1A plus, which a couple can become parents. It is also a single man can opt just to have for gestational surrogacy. In this case, the man being a single parent, give a sperm and require donated eggs, which are fertilized by this man's sperm in the lab and then transferred as embryo or blastocyst to the surrogate, which is the person who's carrying the pregnancy for this man. Now, it can be also done in a situation whereby there is a difficulty in a particular person to carry pregnancy to term. That's an issue of recurrent pregnancy loss. Then the option of gestational surrogacy can be used to help the couple to achieve pregnancy. The third scenario as well is a situation whereby you have a person, especially in Africa, due to multiple operation of fibroid or multiple fibroids, and during the process of removing the fibroids, that person happen that you get your womb damaged beyond reconstructions, and that womb, probably endometrium, cannot grow to accept the pregnancy. In that situation, gestational surrogacy can be used to assist you to achieve pregnancy. Remember, in this situation, the problem lies with your uterine or your uterus, either or your uterine wall, uterine cavity as well. Now we have got other conditions as well which may affect the inside of the womb, which we call Asherman syndrome, adhesions, which are difficult to treat after resection and putting somebody on medication like estrogen so that you can build the endometrium and then you can be able to transfer the embryos and then implantation can happen. Because of the damage incurred by adhesion, scarring of the inside of the womb, and even curate due to multiple abortion and so forth. That can damage the inside of the womb, and that womb not able to carry the baby at all, or there's no implantation and there's no growth of the uterine cavity so that implantation can happen. Therefore, there are also medical conditions which we should think about, which may lead to what we call a situation where a surrogate or gestational surrogacy may be used to achieve pregnancy. In this case, are medical conditions. In case of lupus, in case of cystic fibrosis, in case of past reproductive cancer of the reproductive system, in case of severe diabetes, which is not controllable, which in any pregnancy there's no growth, the baby present with severe intrauterine growth as early as 18 to 24 weeks and there's no growth at all happening, then gestational surrogacy can be an option to assist this couple. Asherman syndrome is an adhesion which can be caused inside the womb, which can let the womb be foreign, be difficult to inhabit a baby. Uterine anomalies, it's one condition as well. Now, it's very important to understand all these reasons which may lead people to have what we call a surrogacy or gestational surrogacy. The other common condition, although it may be rare, is what we call congenital abnormalities of the uterus, where you've got Mullerian agenesis or hysterectomy due to emergency. In other words, you have postpartum hemorrhage, and then the doctor decides to save your life by doing hysterectomy. Therefore, in those cases, gestational surrogacy can be of help to get you to have your family completed. Now, the most important thing is really, where can I get a gestational surrogate woman? You can get in two ways. One, it can be through an agent. In that case, you don't know the person and the agents do get a person for you, and that person go through an agent and then is allocated to you to assist you to get your pregnancy or your family completed. The other option, it may be a family member, a relative, a close friend, can also be used with an agreement with you to assist you through your journey to have children. I personally, as an African person, and with many patients I've seen, I see the second option of gestational surrogacy, where the family member, a relative, or a close friend assisting, be more supportive, more successful, and more bonding in that family, and then it bring more joy because some of the couple have gone 2 or 3 babies and all from one person who was a family member assisting them through. Therefore, it's important that to really to select a very best person to be a gestational surrogacy. And it's very important that onset, or when you start, you write down everything you agree with your surrogacy and you make sure that those needs are met. Those can be medical care, that can be traveling expenses, health insurance, accommodation, food, clothes, and so on. Therefore, those things should be put in line and probably in the contract so that you guys, you can go through with no problems. Thank you in your journey. If you're planning the journey of having a surrogate to assist you further, yes, it's still an option. Yes, it's still an option you can think about. Yes, it's an option which can be useful if you have that kind of a problem which I've mentioned above. Thank you.